Somatic disorders confusing as anxiety. Suppose a child complaining the chest pain, palpitation, and pain. They are not always cardiac. So anxiety can cause this sort of abdominal pain, upper abdominal pain, chest pain. So to see clinically, is there any symptom or sign of cardiac disease? If you think, you might need to do an echo, and in the adolescents and an adult, you might need to do one troponin 1. In asthma, is have severe sort of at times in the nocturnal wheeze and breathlessness. So exclude asthma clinically by typical history, relapse with bronchodilator, worse at night, and previous history of similar sort of things, and maybe the lung function test. Epilepsy has, the aura, and during seizure one can have some of the anxiety symptoms. So exclude the typical epilepsy but typical history. Suppose in grand mal you have three stages typical, and so in the petit mal you have absent seizure, you have finished, so you have complex seizure. So these symptoms will differentiate between the epilepsy and your somatization or anxiety neurosis disorders. Sudden increase in blood pressures in some of the conditions, neuroblastoma, your pheochromocytoma, fluctuating BP, can have some of the symptoms which can be excluded by the ambulatory blood pressure monitoring and maybe by their respective hormone assay and other imaging evidences. Thyroid function test. Thyroid disorders, thyrotoxicosis can have palpitation, tremor, and panic attacks or persistent anxiety. Needs the exclusion of the hyperthyroidism or thyrotoxicosis by doing one TSH, thyroid stimulating hormone. So this disorder needs meticulous exclusion before labeling them as anxiety.